Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
You're listening to Healthcare Matters, the podcast that breaks down the healthcare policy, access, and economic issues that matter most to patients and families. I'm Dr. Robert Popovian in Washington, D.C. I'm a pharmacist, an economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation. Before we get started, I'm very pleased to welcome Angela Degrassi as my new co-host here on Healthcare Matters. Angela is a Senior Manager of Patient-Centered Research Operations and Engagement at GHLF, and she's joining me from New York. Angela, welcome to the program, and why don't you take some time, introduce yourself to our audience here.
Hi, Robert. Thank you. And it's really great to be here. I'm excited to join you for Season 7 of Healthcare Matters. I'm Angela Degrassi, Senior Manager of Patient-Centered Research, Operations, and Engagement at the Global Healthy Living Foundation based in New York. My work is centered on elevating patient perspectives and making sure that conversations about research and policy stay grounded in the real day-to-day experiences of people living with chronic disease and other health challenges. I'm especially looking forward to these conversations, bringing a sense of curiosity to the issues we cover and helping to connect the policy discussion back to what it actually means for patients and caregivers in their everyday lives.
Angela, you and I have known each other a long time. We're thrilled to have you as a co-host since Ben left and went to much more greener pastures, as he claims. We'll see. Angela, today I want to discuss something with regards to access to oral antiviral treatments for COVID-19, especially for populations that GHLF serves, older patients with chronic diseases. Those are our patient population generally, patients with autoimmune disorders. So a new CDC report suggests that these treatments may be underused even among patients who are at high risk, like GHLF patients. At the same time, GHLF, we did a survey this past year, and we published it last year actually, and found that awareness was high. People knew about the antivirals for treatment of COVID, but many patients still did not receive the prescription. So today, I want to talk about what this means for patients, caregivers, especially in lieu of this new study that came out from CDC that supports what we found at GHLF last year in our survey.
Yeah, let's dive into that. That's exactly why this conversation matters. We have effective treatment options, but for many patients, the real question is whether they can access them quickly, understand when and how to use them, and then actually get them at the moment they need them most.
So let's get into it.
So let's zoom out for a second. A new CDC study looked at how often older adults are actually being prescribed COVID antivirals. What did they find, and what feels most important for patients to understand here?
So first and foremost, I'm a pharmacist. You know that, Angela. My biggest thing is get vaccinated. That's the best way to prevent the disease. But we live in the real world, and we know that not everybody's going to get vaccinated. So we have good quality treatments for patients who get infections. And what the study found was that treatments seem to be underused. When people know that the COVID infection rate is high, they seek out this treatment and the providers prescribe it. But when nobody's talking about COVID or the rates are low, that's not happening. But that's a problem because, as the study found, a lot of the patients who they looked at were the older patient population with chronic diseases. So it's a problem that we have very good antivirals that reduce the chances of hospitalization, mortality, and morbidity in patients who are older and require treatment. Without a doubt, we're seeing that they're not being prescribed, and it's a missed opportunity to really help the patients. And that's what the CDC study found.
Yeah, and that's one thing that really caught my attention is how prescribing seems to rise when COVID feels urgent and then quietly drops off when it doesn't. It almost tracks with the national mood of COVID. So should access to antivirals work that way, or do you think it should be much more anchored in individual patient risk?
It absolutely should be based on patient risk, not headlines, like you mentioned. And that's what we're seeing, right? As the headlines grab everybody's attention about COVID or measles or flu or something else, everybody rushes and gets their vaccines or gets their treatments. And then when the headlines go away, everybody runs back to what they were doing prior to. But the problem is with the patient population, especially the patient population that we have at GHLF and what the CDC found, prescribing behavior should not be based on headlines. It should be based on risk. And high-risk patients deserve better. The problem, because the virus has not disappeared, I just did a back of the envelope calculation. Last 12 months, we've had over 19,000 deaths from COVID. So the virus is still around. And for patients with high risk, the consequences are serious. So we need to take this seriously and make sure that patients at risk do get these treatments.
Yeah, I agree. And that connects to something GHLF saw in its own survey. A lot of patients with chronic conditions already knew these treatments were out there, but that awareness didn't necessarily translate into getting a prescription. So, where does that gap really open up? Is it timing? Is it conversations people are having with their doctors? Or people being uncertain about their eligibility? Or really a mixture of all those things?
It's a mixture, but I would also add, Angela, there's two other things that you didn't mention that can impact it. So we didn't have the issue of out-of-pocket costs or opportunities to have testing free for everyone. But dial back about 24 months ago, the government was covering the out-of-pocket costs still for the antivirals, and free testing was still somewhat available. But today we're at a situation where there's no tests that are available for free for patients like we did maybe 24 months ago, 36 months ago. And in addition, patients face this out-of-pocket cost. So yeah, the GHL surveys showed the same thing as the CDC, that the awareness was high, yet only a little more than half of the respondents got the antiviral. Some of it had to do because they went to the physician and they were outside the window of treatment, or the physician felt that they were not sick enough, which was really interesting. You work with our patients more closely than I do. All GHLF patients have a chronic disease, but majority of them are also immunocompromised and have autoimmune disorders. So it's interesting to see that in the survey, the feedback was, well, I went to my provider, but the provider didn't feel that I was sick enough to get the antiviral, which is interesting. It's like a chain of missed opportunities for their patients, similar to what the CDC found, we found in our survey. As I said, we have the issue of out-of-pocket costs now, which is another hindrance for patient getting it, and lack of testing that is available unless the patient wants to buy it.
Interesting. And one of the more reassuring pieces of this is that when people do get prescribed these medications, many are able to start quickly and take them as directed, which makes me wonder, does that point to the bigger issue being less about the treatment itself and more about the missed moment to offer it?
That's exactly the right way to frame it. When the patient take it, it's effective. It's a bunch of missed opportunities. The problems is not just the prescribing, it's whether we have tests available, are they being tested quickly, are clinicians proactively talking about treatments, and what we started with, the headline issue. If the people are not aware of it and are not concerned about it, is that creating an environment where the prescribing is not happening? But we know when they get prescribed, patients do take it and it's very effective.
So, for patients, caregivers, and families listening, especially those who are older, immune compromised, or living with chronic illness, what should that moment look like? You test positive. What's the next move if you want to make sure you don't miss that treatment window?
So you're talking about our patients, right, Angela? The
Yeah.
GHLF patients are what you described right now. So first and foremost, do not wait and see. Timing is everything. There's a window of opportunity for the treatment to really be effective. So test promptly, document the results, contact the healthcare professional right away. Ideally, it's same day as you get tested. If you're older, have a chronic condition, ask directly whether you're eligible for this and make sure they understand that you have tested positive and you've documented this. If you have a physician, call your physician right away. If not, go to an urgent clinic. In addition, there are telehealth systems set up to be able to prescribe this drug over the phone. Some states allow pharmacists to prescribe these drugs. If you end up going to a pharmacy and the state is allowing it, you can take the test with you and the pharmacist can prescribe the antiviral. But it's important. Promptness is the most important thing here. As soon as you're tested positive, you got to take action because there's a window of opportunity that you will be benefiting from this therapy.
That's really helpful, and I'm glad you mentioned a few things that I hadn't thought of or hadn't remembered. Your pharmacist being able to prescribe in some places, and then also telehealth. Thanks for sharing that context. And before we wrap up, I want to give you the last word, Robert. What is the one takeaway you want patients, caregivers, and healthcare professionals to remember from this conversation?
First and foremost, get vaccinated. We have an effective, safe vaccine available. Prevention is the best cure for any disease. We want to prevent the disease and not have to go through it. However, again, we live in a real world. A lot of people don't get vaccinated today for a variety of reasons. We have effective treatments, and lower public health attention to COVID should not mean lower attention to high-risk patients, especially older patients with chronic diseases. We have effective tools, as I said, to treat this illness, and for older adults and people with chronic conditions, timely treatment matters and should be a part of the plan and not an afterthought.
Thanks for breaking that down for us, Robert, and thank you all for listening. That wraps up today's episode of Healthcare Matters. Don't forget to subscribe on Apple Podcasts, Spotify, or wherever you listen so you never miss an episode. And if you found this conversation helpful, please share it with your family, friends, and community.
And if you have questions, thoughts, suggestions, we're always listening. Send us an email at podcast@ghlf.org. We'd love to hear from you. And if you have a great idea, we will bring you on this podcast, and Angela and I will interview you or give our feedback to some of the stuff that you brought up on your email to us.
And be sure to check out the rest of the GHLF podcast network at ghlf.org/listen. He's Dr. Robert Popovian.
She's Angela Degrassi. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.